guys, it's Leah B from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and discuss the top 5 conditions related to back pain and VA disability. So this is the top 5 conditions that I see veterans obtaining secondary service connection for. It's not necessarily the top 5 conditions that VA has posted somewhere, but these are the most common things that I see as a former CMP examiner and in my current capacity related to back pain, right? So really quickly, let's talk about back pain and how it can be related to service. So many veterans are service connected for back pain due to experiences that they had on active duty or in their reserve or National Guard time on active duty status or whatever. Whether it's related to occupational stressors, maybe you were an 11 Bravo infantry paratrooper, maybe you were a mechanic and you were constantly doing physical labor. I mean, all active duty service members or all service members have some level of physical activity at any point in time, right? But maybe you had an accident, maybe you got injured in combat or otherwise, but something that happened while on active duty and has continued can sometimes be something that is related on a primary or direct basis, okay? There's also many veterans that are service connected for back pain on a secondary basis to other disabilities. So perhaps you have a service connected knee pain or a hip pain, and that has led to you having back pain. Sometimes veterans can be service connected on a secondary basis for that back pain. Also, I've seen veterans that have obesity related to one of their other disabilities, and the excess weight has caused, stress on the back. Sometimes as an intermediate step, back pain can be related to obesity. And inversely, it can cause other disabilities if you have lack of exercise, et cetera, related to a service-connected back pain, which we're going to get into. So, the top 5 conditions that I want to talk about today are, and we're going to go over each one of them in depth, are radiculopathy, okay? Mental health conditions like depression and anxiety. Number 3, sleep disorders like sleep apnea, with weight gain as an intermediate step often. Other joints like the hip or the knee or the ankle. And then lastly, gastrointestinal disorders like gastritis or GERD related to medications that veterans often take to treat their back pain, okay? So let's just jump straight in. You guys know I like to always share my literature that I use in a lot of my reports so that you can sort of go review these peer-reviewed articles yourself, talk to your treating provider about it. Perhaps they'll write you a medical opinion to support your claim. Nexus letters are never required, but sometimes they can be helpful. And if your treating provider is willing to support you, if you can show them some literature, they may be more, apt to helping you or whatever. They might not be. But so radiculopathy, what is radiculopathy? So radiculopathy is a condition caused by nerve compression at the level of the spine, right? So the nerve can get compressed, herniated disc, degenerative disc disease, things like that. And those nerves that feed to your extremities, your lower extremities in particular for the low back, they can become affected and you can get paresthesias, numbness, tingling, weakness in the extremities. I actually had this recently in my neck, but my neck fed into my arms. So I was having the symptoms in my arms. I did a lot of physical therapy and I did some traction, and that was actually really helpful to get some of the symptoms to subside. But unfortunately, like many of you, I have what I like to call army back, right? I have army back and army neck. So I've got a lot of degenerative disc disease, herniated discs, just a lot of army back, right? So eventually I imagine that that's going to probably be something that's going to be, having flares throughout my lifetime. And hopefully I can not have to have like a fusion or something like many of you have probably had in your lifetimes. So let's talk about radiculopathy. So I'm going to go over some of that literature that I like to use. So there's an article entitled Causes and Risk Factors of Lumbar Degenerative Disc Disease, published in Spine Health. It discusses the degenerative cascade, and it talks about a stress to the back can cause the disc to wear down relatively quickly, and that degenerative cascade can lead to that impingement on the nerve root, right? Another article called Lumbosacral Radiculopathy, published in Neurologic Clinics, reports that lumbosacral radiculopathy is a term used to describe a pain syndrome caused by compression or irritation of nerve roots in the low back. Radicular pain is typically characterized by patients as electrical shocks or shooting pains that radiate from the buttocks to the foot. And it goes on, right? So it's good for you guys to be able to pull that article up. Again, lumbosacral radiculopathy, published in Neurologic Clinics. You should be able to do a pretty quick Google search for that and find the articles. That should be helpful for that. Let's move on to the next condition. Hang on one second. So the next condition we're going to talk about is mental health conditions, right? So any physical pain, right? Any physical ailment, depending on how bad it is, can lead to or contribute to mental health conditions like depression, anxiety, insomnia, a variety of things, just because you're dealing with it on a daily basis, right? So some of the articles our docs use, our psychologists use with these are, let's see here. The family environment in chronic pain patients, comparison to controls and relationship and patient functioning. And that can be found in the Journal of Clinical Psychology and Medical Settings, found that depression is present in 31 to 100% of people with pain, as chronic pain can impact mood because it is an ongoing stressor, right? It's not just like a one-time stressor, it's ongoing. And approximately 90% of patients with chronic pain develop depressive symptoms at the same time or after the chronic pain diagnosis. Another study from 2009 called Comorbid Chronic Pain and Depression, Who is at Risk, from the Journal of Pain, found that approximately 35% of people with chronic pain also had a probable diagnosis of depression. And there's more language in there as well. But the important thing is for you guys to be able to find those articles and pull them up, read them, share them with your treating providers. Another article titled Chronic Pain Associated Depression, published in Psychiatry and Behavioral Sciences, is another good one. Let's see, I'm going to give you one more for this. Chronic pain can lead to depression and spine health. That's actually an online article, spinehealth.com, in 2015. And one more, depression and chronic pain, from authors Holmes, Chrysalis, and Arnold, from 2013, determined that chronic pain and major depression commonly occur together. In addition, the authors asserted that major depression in patients with chronic pain is associated with decreased function, poorer treatment response, and increased healthcare costs. Okay, I'll probably do a separate video just on chronic pain and depression and back pain and things like that, so we can go over that more in depth. But I want to move on to, for this video, I want to move on to the next condition, which is going to be sleep apnea, right? So sleep apnea, we've done videos on obesity as an intermediate link. And so if you haven't checked those out, those are really good. So if you've got any medical condition that is directly causing you to become obese, and that if it wasn't for that obesity, you wouldn't have the medical condition, VA can recognize this. This is not in all cases, right? If you're overweight because of lifestyle choices, that's different. But let's say your back pain is so debilitating, or let's say you've got a knee condition and you have an amputation, or you have something that prohibits you from doing exercise, even mental health conditions. If you've got a mental health condition that makes you have a social phobia, not want to go out of the house, maybe you have a eating disorder because of it, or you drink too much, and all these compensatory mechanisms lead to weight gain, that can sometimes cause other ailments, right? So back pain, if a person has back pain and it's made them become very debilitated and led to obesity, that can be tied to other diseases like sleep apnea or other disorders. So I'm going to give you a couple of articles about exercise. Let's see. Actually, before I even get to those, I'm going to give you some that just talk about chronic pain. So an article titled The Association of Obstructive Sleep Apnea and Chronic Pain, published in Medscape in 2013, outlines evidence supporting increased sleep apnea prevalence in those who suffer from chronic pain, specifically that a bidirectional relationship exists between pain and sleep disturbances. Pain fragments sleep continuity, impairs sleep quality, and disrupts normal sleep architecture, okay? Let's see. if you're taking opioid medications, right, for your back pain, sleep disturbances in patients taking opioid medications for chronic back pain. That's an article that we use. Let's see here. Okay, reducing calorie intake may not help you lose weight, published in the Perspectives of Psychology Science. It aims to just discuss that weight gain alone is not going to be, you're not going to have an effect based on dietary modifications. So dietary modifications can be helpful in the short term, but long term, we really need to have exercise to help us be able to keep that lifestyle, right? Another article, Obesity, Abdominal Obesity, Physical Activity, and Caloric Intake in the US from 1988 to 2010, published in the American Journal of Medicine. It examined trends in obesity, abdominal obesity, physical activity, and caloric intake in the US adults from those years, and found conclusively that BMI and waist circumference trends were associated with physical activity, but not calorie intake. Okay, so other joints. So I'm gonna just give you one on hips right now. So really, if you have an antalgic gait, or if you have an altered gait because of pain or because of dysfunction in whatever joint it is, that can lead to biomechanics being messed up in other gaits, right? Ambulatory dysfunction. So the relationship between low back pain and lumbar and hip joint movement in desk workers, published in the Journal of Physical Therapy Science, is a good article. The hip spine syndrome, how does back pain impact the indications and outcomes of hip arthroscopy? Discusses significant relationships between the hip and the spine. Effect of low back pain on kinematics and joint coordination of the lumbar, spine, and hip during sit to stand and stand to sit, published in Spine in 2005. And I'll give you one more for this. Adaptations in pelvis, hip, and knee kinematics during gait and muscle extensibility in low back patients, a cross-sectional study published in the Journal of Back and Musculoskeletal Rehabilitation. So that's a good one as well. So let's jump over to gastrointestinal disorders. So I've seen people get service connected for things like IBS due to medication use as well, not as frequently, but I see GERD and gastritis quite frequently due to that GI upset from NSAIDs, anti-inflammatories. And I think we've got a good video on that specifically if you want to check that out, if this category like interests you at all. So I'll give you a couple articles here. So it is known that the use of NSAIDs are likely to precipitate the development of GERD. An observational study titled Non-Steroidal Anti-Inflammatory Drug Use, a Risk Factor for Gastroesophageal Reflux Disease, an observational study published in 2008 in Alimentary Pharmacology and Therapeutics, asserted that out of 6,823 respondents, and 2,262 reported using NSAIDs during the previous 3 months. And the authors reported that the associations between NSAID use and peptic ulcer disease and dyspepsia are well established. GERD symptoms were significantly more common among NSAID users than non-NSAID users, and it just goes on and on. Another article, Mechanics of Damage to the Gastrointestinal Tract from Non-Steroidal Anti-Inflammatories, is another good one. And non-steroidal anti-inflammatory drug-induced failure of lower esophageal and pyloric sphincter and counteraction of sphincter's failure from stable gastric pentadeceptide, sorry if I butchered that, BPC 157 in rats, published in the Journal of Physiology and Pharmacology, focused on NSAIDs induced failure of lower esophageal and pyloric sphincter in an attempt to counteract the sphincter failure. So that is what, part of what causes GERD is that failure of the sphincter to keep the acid down. Okay. So I hope this was helpful. And I think that was all 5 conditions that I was going to discuss today. Please drop some comments if you have any. I hope these articles may help you on your journey. And thanks for watching. All right. See ya.